The Select Subcommittee on the Coronavirus Pandemic will come to order. Welcome, everyone, and without objection, the Chair may declare a recess at any time. I now recognize myself for the purpose of making an opening statement. We're here today to examine the Department of Health and Human Services compliance with the Select Subcommittee's oversight request. I'm sorry we're even having this hearing today. It is unexpected because of the expectations that agencies will work with Congress openly and transparently on behalf of the American people. But it is time the department answered some questions. We tried once before. As you know, we issued a subpoena for your deposition. But the department assured us things would improve and your testimony was unnecessary. The department's compliance has not improved. To this day, your department continues to stonewall this subcommittee. The department has produced documents with unnecessary and some illegitimate redactions. As you can see on the screen, the department redacted every name in this document, even foreign nationals. When asked why, we were told it was because of security concerns. When asked how the department knew these individuals had security concerns, the department was unable to provide an answer. The department has produced documents that are simply unrelated to our request. You've produced documents that are not relevant to our requests, or hundreds of pages of news articles. This is unacceptable and simply seems to be a tactic to inflate your productive page count, which I'm sure you will tell us about today. And maybe most shockingly, the department's failure to produce documents we know are in your possession. Again, on the screen is a document that the Oversight Committee made public 2 years ago. The email has yet to be produced to this subcommittee. I can't understand why. You know it exists. You know how to find it. The fact this hasn't been produced raises serious questions and implies that the department is intentionally trying to withhold something or hide something. Regarding interviews, we do appreciate the department employees have chosen to voluntarily comply with our request. I will state that the subcommittee accepted every single date that the department proposed. Despite this compliance, the department and all your lawyers have routinely attempted to hinder witness testimony. The night before each interview, you personally issue a memo to the subcommittee and the witness, instructing the witness as to what they can and cannot testify to. HHS has blocked witnesses from discussing the EcoHealth Alliance grant reinstatement. We wonder why. HHS has blocked witnesses from discussing EcoHealth's current grant status. We wonder why. HHS has blocked witnesses from discussing COVID mitigation measures. We wonder why. HHS has blocked witnesses from discussing internal communications. Why? And HHS has blocked a witness from discussing anything he did through his official capacity at NIAID. Again, why? This select subcommittee was formed with the intent of performing an after-action review of everything that happened during the pandemic where 1.2 million American lives were lost. We want to know what we did well, what we could do better in the future, and how to prepare for the future. Hiding what was done does not help. Is HHS funded by someone other than the American people's taxpayer dollars? No, I hope not. This is acting in bad faith at best and a violation of law at worst. I've read your opening statement. Frankly, it's somewhat insulting. There's no significantly relevant facts or data in there. There are no explanations for the questions you know we have. In fact, it raises more questions than it does answers. In it, you boast about producing more than 30,000 pages to Congress during the 118th Congress. Curiously, during the 117th Congress, in a similar amount of time, the department produced more than 43,000 pages to one oversight subcommittee alone. What changed? What changed besides who's in the majority in the House? Was it no longer in the department's interest to be overly compliant? And if not, why? You say the department has been exceptionally responsive to the subcommittee. I think we could contest that assertion, and perhaps we have a different definition of exceptional. That could be. On February 13, 2023, we sent a letter regarding the origins of COVID-19. It has taken 2 follow-up letters, 2 staff meetings, subpoena threats, and scheduling interviews to begin receiving unique documents. Documents that belong to the American people, and documents that Congress should have easy access to. Out of the 10,000 pages produced, of which I would note more than 1,000 were produced last night, just last night. The majority of the documents are previously publicly available. Some are more redacted than FOIA productions. Others are non-responsive to the questions or copies of press articles. On March 10, 2023, we sent a letter regarding the process of approving the COVID-19 vaccine. We received fewer than 300 pages more than a month later and have not received any documents since. And common sense in reviewing them would suggest that there are more that we have not received. On March 28, 2023, we sent a letter regarding the Biden administration school opening guidance. It took 2 follow-ups, a subpoena threat, and scheduling transcribed interviews before the department was compliant. On August 1, 2023, we sent a letter regarding the implementation of COVID-19 vaccine mandates. You have not produced a single document on that. On August 2, 2023, we sent a letter regarding CDC Director Cohen's statement about annual COVID-19 boosters. Again, you have not produced a single document. On August 23, 2023, we sent a letter regarding the illegal Chinese lab in California. You produced fewer than 100 pages that were all previously publicly available. Did you have no internal documents concerning this issue? On September 6, 2023, we sent a letter regarding former CDC Director Walensky's override of booster recommendations. You've produced about 100 pages that are all already available on the CDC's website. You may as well just send us the link. But it adds to the number of pages that you've sent us. On October 13, 2023, we were forced to subpoena records regarding an NIAID employee's use of personal email. You said you were prevented from producing documents because it was an internal investigation, an excuse that's not founded in fact. We're conducting an investigation. We have oversight over HHS. Our investigation overrides your internal investigation. Understand that going forward. This is not a track record of exceptionalism in my mind. It's not a track record of competence. And this is certainly not a track record of compliance or transparency. Dr. Agorn, compliance with Congress is not voluntary. Time and time again, we hear the department is providing witnesses or documents voluntarily. And why that may be legally accurate and appreciated when they do it, it provides the perception that you believe that you have a choice. You do not. Congress created your agency. Congress funds your agency through the generosity of the American taxpayer. And that is who you serve. And Congress has the absolute right to oversee your agency on behalf of the American people. And they know that. Barry Goldwater said, "The Constitution is not an instrument for the government to restrain the people. It is an instrument for the people to restrain the government." I think that's where we are. I hope we can get answers today and get back to the work on behalf of the American people. The same American people who lost 1.2 million loved ones because of COVID. This is an after-action review of the government response to the COVID-19 pandemic. It should not be partisan. It should not be controversial. But it needs to be based on facts. Facts that you have that we are not getting. And the department's honesty and cooperation is non-negotiable. I would now like to recognize Ranking Member Ruiz.